Hey there, I'm Joshua Johnson. Good to be with you on this Friday, December 17th. Here is some of what we're talking about tonight. The Omicron variant has many people feeling uncertain about what the holidays will look like, or January for that matter. But as the variant quickly spreads, the Biden administration announced a plan to keep kids in school. One casualty of the pandemic, standardized tests, at least at some universities. Now, Harvard University has taken a step toward making that policy more permanent. We'll explore. Then,
we urge the Department of Justice to ensure arrest and prosecution of disruptive passengers on the plane and in the airport.
Airline unions are asking for more government action to make their workplaces safer. Plus, why do some hospitals charge patients wildly different prices for the same services? We'll meet a healthcare executive with some ideas for fixing that. And the Library of Congress is preserving more of our favorite movies, from Elm Street to Mordor to a galaxy far, far away. You'll see the 25 additions to the National Film Registry. So before you start your weekend, let's begin tonight with COVID. And I know it's easy to get caught up in the constant drip of bad news with the Omicron variant. And there was a lot of it today. But with the variant spreading, we should at least catch you up, especially on the Biden administration's plan to keep schools open. First, let's begin with some breaking news that came in just literally a few minutes before we went on the air. A federal appeals court has reinstated the administration's vaccine and testing requirement for many private businesses. Now, the rule requires workers at businesses with at least 100 employees to either get fully vaccinated or get tested every week. And a federal appeals court has reinstated that policy. It goes into effect on January 4th, covering about 80 million workers. No word so far on whether another appeal is coming. Meanwhile, this afternoon, the director of the National Institutes of Health forecast that Omicron could soon be the nation's dominant strain. It may lead COVID cases within 2 or 3 weeks. Today, Ohio became the latest state to deploy the National Guard to hospitals. Guardsmen will help with staff shortages. New York State just set a pandemic record for daily COVID cases, nearly 21,000. Multiple sports leagues, both college and professional, are postponing or canceling games because of confirmed cases. Also, more school districts across the country have canceled in-person learning because of outbreaks. Shifting back to virtual learning can be a challenge for everyone. But today, the Biden administration announced a new strategy in hopes of keeping students on campus. They call it a test-to-stay approach. The idea is to reduce mandatory quarantines after a child is exposed to COVID. Instead of just staying home, children could remain in school if they test negative at least twice. Test to Stay is meant to keep America's 60 million school children in school and on track. And all of this raises plenty of questions about this strategy and about what the next few weeks might look like. Let's dive into that with Dr. Susanna Hills. She's a pediatric airway surgeon at the Columbia University Medical Center. Dr. Hills, welcome to the program.
Thanks so much for having me.
What do you think of this Test to Stay strategy? Does it sound like a good idea?
You know, I think it's great, Joshua, that the Biden administration is supporting something different, a strategy that will help keep kids in school. We just don't have a whole lot of data about how effective it will be, particularly with this new Omicron variant. But when they looked at schools in LA and in Illinois who had employed this strategy, infection rates were around 1% to 1.5%. And so it really kept infection rates down so far anyway in the data that they have. So I think it's worth trying and exploring, and certainly anything we can do to keep kids in school safely, I'm all in favor of.
I just want to kind of underscore what you just said, that this has been tried in a couple of districts on an experimental basis, including the pretty large districts. So this is not something that's just kind of, that they're just hoping works. There's some data to suggest that this might be applicable on a larger basis.
Yes, and there around 90 schools in LA and a large number of schools in Illinois used this strategy, and it was fairly successful. You know, those are really very reasonable infection rates for kids who had potentially been exposed and tested and went back to school, and the schools are able to stay open with those low infection rates.
I know some parents have got to be worried about sending their kids back to school after the holidays, and then also worried about keeping their kids home after the holidays. I mean, keeping kids at home has been a real hardship for a lot of families. How are you thinking through the way that we move forward with kids and schools, knowing that, as you said, there's a lot we don't know about this Omicron variant, except that it spreads very, very easily?
Yeah, that you are bringing up a really challenging but important point that's really top of mind for essentially all parents right now. You know, we're seeing some schools closing in Maryland and in DC and in Texas just in the last 2 days. And I think parents were just so hopeful and pleased to get their kids back in school. The effects of being in quarantine and being out of school have been really significant. And it is really discouraging to think that we could be in a situation where we end up with yet more school closings, more quarantines. So it's really challenging. The one thing that every family should remember, the one area of control that they have over protecting their children is, well, there are two areas really. First of all, getting vaccinated and getting boosted. If you're eligible and able to do so, that's just going to be so important in protecting those kids who aren't eligible to get vaccinated or haven't been fully vaccinated yet. And then all of those measures that we've been using all along and advocating for, the hand washing and masking and social distancing, those measures were being used in those schools that were successful in that test and stay strategy. And they are effective against all viruses, including the Omicron and including any other variant that might come along. So those are things that parents still have control over, that they can still do to keep their kids safe and healthy. So the hand washing, masking, all of those things are still so important.
You're a pediatric airway surgeon. What are you seeing these days in terms of how kids are holding up under the pandemic?
Yeah, it's been really challenging. There's definitely been lots of concern about school development and getting back to school safely, and delays and setbacks in educational development with kids as they get back to school this year. So I see lots of parents coming in to see me, not just for infection, but for concerns about other issues with learning and concerns that their child may not be learning as well as they could. And that comes up in our ENT clinic with hearing issues and speech and language and other kinds of developmental delays. So we're seeing more of that, more heightened concern about that, and concern with parents also who haven't gotten the resources they've needed in the last year and a half for kids who've needed special educational support, and they've been behind because they haven't gotten the same services they're used to. So now for those families that have concerns about, yet again, being out of school, the potential developmental concerns are really significant.
Before I let you go, I definitely want to ask you about the news from Pfizer today. They said that they tested their 2-shot vaccine regimen on children from 2 to 5, and that it was not effective, or at least not as effective as it needed to be, and now they're going to go on and try a 3-shot regimen to see if that provides a better immune response. What should parents be keeping in mind about all of this as we try to figure out how to vaccinate children as well as adults?
Well, a couple of things here, Joshua. One, I think it's really important that the right steps are being taken for safety here. They're using a low dose, 3 micrograms of the vaccine. It's less than for any of the other age groups because this is a smaller, younger population. And they're being very, very careful in not increasing the dosage too dramatically and getting the right data that they need before they submit this for FDA authorization. It does also mean, though, unfortunately, that there will be a setback in getting that data to get authorization for a vaccine to be available to this younger group. So not until the coming year, hopefully in the first half of the coming year, will we really have data to potentially submit for a vaccine for that age group. So that just means everybody has to be still extremely vigilant and very careful with protecting themselves with vaccines to keep these younger kids safe and protected.
Dr. Susanna Hills of the Columbia University Medical Center. Dr. Hills, I appreciate you making time for us tonight. Thank you very much.
Thank you.
Children ask great questions, including about COVID. We would love to know how you are guiding your kids through this pandemic. What do you do to inform them without scaring them? Or if you have decided not to discuss COVID with them at all, how did you reach that decision? Tell us your story. We are at NBC Now Tonight on Twitter, Facebook, and Instagram. Leave us a voicemail, 888-575-2NBC. That's 888-575-2622. Or you can email us nowtonight@nbcnews.com. Still to come, standardized tests are no longer the standards for more colleges, including Harvard now. We'll tell you why some schools are ditching the S.A.Ts. We're glad you're with us for Now Tonight from NBC News. Getting into college can be a real numbers game, especially where S.A.T. scores are involved. But all that worrying over math, writing, and essay scores is becoming a thing of the past. More schools are moving away from standardized testing as an admissions requirement. That now includes the nation's oldest university, Harvard. Last year, at the start of the pandemic, it made the S.A.T. optional for applicants. Today, Harvard announced that it will extend this policy for another 4 years. The university says COVID made it much harder for students to get to testing sites. Colleges started backing away from the S.A.T. and A.C.T. over concerns that they contain inherent biases. Critics say those biases make it even harder for some students of color, who are already disadvantaged, to get ahead, no matter how smart they are. Harvard joins a growing list of schools that have either deferred or eliminated standardized tests as a requirement. Others include Cornell, the George Washington University, and Wake Forest. This March, Cal State, the nation's largest four-year university system, will vote on permanently ending this requirement. The University of California system already eliminated the tests for admission. So what does all this mean for higher education, especially as more universities try to diversify? With us now is Anna-Mona Hardikolis. She covers higher education for the New York Times. Ms. Hardikolis, welcome. Glad to have you with us.
Thank you. Glad to be here.
With this decision at Harvard, was there any prospect really of them bringing back the S.A.T. absent COVID's impact, or was this the kind of thing that they sort of expected to do this coming year?
You know, I can't read the tea leaves on that, but COVID clearly opened the door to allow them to do something that they wanted to do. So the reason they gave was COVID, but there were clearly other reasons on their agenda as well.
What do you make of this shift away from standardized tests? I mean, it makes me wonder if COVID became just sort of the catalyst for a number of institutions to do something they'd been thinking about for a while, considering how much flack the S.A.T. and the A.C.T. have gotten over claims and concerns that it disadvantages students of color.
Exactly. So this has been a long-standing trend, and it accelerated during the pandemic. Before the pandemic, about 45% of schools, according to Fair Test, which has some measurements of this, were moving away from the S.A.T. and the A.C.T. Since the pandemic, 80% of schools have done it, albeit saying that they're doing it temporarily because, as you rightly said, students can't get to the testing centers. But now Harvard, in kind of a stealth announcement yesterday, buried amid statistics on early admissions, said that it was going to extend its own moratorium on S.A.T., ACT scores for another 4 years, and that would be into the class of 2030, graduating class of 2030, which is kind of far beyond the boundaries of the pandemic, even if we assume it's sort of a forever pandemic. So they were looking to solve a problem other than getting access to the test, and people think it was finding other ways to achieve the kind of diversity that Harvard values in its college classes.
Yeah, how does this factor into the other ways in which admissions is evolving? I mean, I understand that Harvard, Yale, and some other Ivy League schools are reporting a near record number of early admission applications. Then there's the perennial argument over legacy admissions, where if your parents went to a school, that might give you an edge on going there too. How does this S.A.T. piece fit into the larger landscape of how colleges are thinking through who gets in and who doesn't?
Admissions is really complicated, and it's true that people whose parents went to Harvard or other Ivy League schools operate similarly have a much greater chance of getting in than those whose parents didn't go. Recruited athletes have a much higher chance of getting in. And this all came out in a lawsuit against Harvard, charging it with discriminating against Asian Americans who tend to have, who among applicants to Harvard have higher S.A.T. scores than any of the others, and yet we're not getting in numbers commensurate with their S.A.T. scores. For Harvard, this is kind of a dilemma. So eliminating the S.A.T. as a requirement allows the university to look at other things that students have to offer, and the admissions director at Harvard, in making the announcement yesterday, Bill Fitzsimmons, said that he believes that admissions can be done fairly without looking at standardized tests, which have been kind of the gold standard for generations.
Is there any future, you think, for standardized tests, or any argument to be made for keeping them in some form? I remember we were discussing this among our team today, and it came up in the conversation that some international students will use this S.A.T. score as a kind of way to create an apples-to-apples comparison between them and students in the U.S. as a way to kind of further their admission. I know the University of California was considering at one point creating its own standardized test that better reflected what it believed UC students needed to know to get in. They've since dropped that. But is there a case to be made for having some kind of standardized testing, or is it kind of all going away?
No, some admissions directors believe very strongly that standardized testing tells them something important. So they would say that they're sacrificing important information by eliminating standardized tests. Therefore, some of them are not going test optional. And what they say is that tests, one, give you a kind of a uniform way of judging students from schools that can be very different, and where an A at one school is not the same as an A at other schools. They also allow them, they say, to find kind of diamonds in the rough, kids who jump out by their standardized test scores who might not have been discovered otherwise, but who clearly are bright. So, so there are trade-offs.
It will be interesting to see how far this goes. Before I have to let you go, I understand that between 2020 and 2021, the number of students who took the S.A.T. overall dropped from 2.2 million to 1.5 million. I think some students have been pretty happy to not have to take the S.A.T. for a while now. Is this trend just going to decline, or does the College Board, the group that makes the S.A.T., do they see any possibility that there might be some resurgence, some way to kind of alter the test, rehabilitate it, evolve it, revise it, and keep it a part of the admissions process?
I'm sure the College Board is thinking about this. Whether they're thinking about how to keep it as part of the admissions process, I'm not sure, but it's becoming more a kind of a benchmark test to be taken during high school, in the school, as an achievement measure. And I think that they're trying to reconfigure the test in that direction.
I should note we did reach out to the College Board and offer them an opportunity to make somebody available for this conversation, or even to send us a statement. That invitation remains open. Hopefully they will respond. In the meantime, Anna Mona Hardikolis of the New York Times, I appreciate you making time for us. Thank you very much.
You're welcome.
Let's stay with Harvard for just a moment, because one of my colleagues just got back from there. In the past few months, NBC's Tremaine Lee taught courses there on the intersection of race, justice, and politics. At the end, he asked his students about their experiences of being black at Harvard.
Mariah Norman. I'm from Cincinnati, Ohio.
So I'm Ife, but my full name is Ifalua Adedoku. I'm from Queens, New York.
My name is Kimani Panthier, and I'm originally from Long Island, New York.
How do you identify?
Caribbean American.
Nigerian American.
I'm a Black woman.
Schools like Harvard aren't keeping track of their Black students' backgrounds, but students I've spoken with estimate that less than a third of Harvard's Black students are generational African Americans.
I was born here, but my parents, most of their adult life was spent in Nigeria.
Generationally African American, which basically means that you're a descendant of enslaved people.
I'm the son of 2 immigrants who migrated here in their early adult life.
We sent a detailed list of questions to Harvard about their diversity and recruitment efforts, the proportion of Black students who are descendants of enslaved people, and those whose families have more recently immigrated, as well as their efforts to address the school's connections to slavery. The school responded with a handful of web links and then declined to comment further. For its part, Harvard in 2019 launched an initiative called Harvard and the Legacy of Slavery to, quote, understand and address the enduring legacy of slavery within our university community.
Is the institution doing enough to actually remedy any of the past?
Simple answer is no. They're missing out on the key part, which is, admitting and seeking out and recruiting generationally African American students, specifically ones that are directly impacted by the effects of slavery. So that's redlining, underfunded public schools, over-policed communities, low-income areas. All of those are directly impacted by the effects of slavery.
In the meantime, Black students from the diaspora are trying to understand where they fit on Harvard's yard.
It was just interesting to see that as I stepped here, I knew people who had come from where I came from and kind of had to conform to the culture here, but we're from Africa.
One of the major disappointments for me coming on the campus was that I imagined it to be this great melting pot, and yet it did not live up to that expectation.
In what ways?
I was expecting I would have white friends, Asian friends, Latinx friends, African friends. But when I got on campus, I found that it was quite the opposite. People stuck to their different cliques. It was just diverse on paper, but in actuality, the college is very segregated.
How much of that do you put on the institution?
I put a great deal on the institution. I think that just admitting 18% of Black students into your student population is not enough.
And I think that change really can start right here, with the Black students, and making more structural changes as we've all talked about, making those tangible efforts to reckon with their past could really inspire America to do the same.
That was NBC's Tremaine Lee reporting. Do check out the latest episode of Into America, hosted by Tremaine Lee. It's called Ebony and Ivy. Download and subscribe on your podcast app. We will pick up the conversation about race and education after the weekend with 3 words that have become startlingly controversial: critical race theory. If you just had a visceral reaction to that term, that's what we want to talk about. To the best of our knowledge, not one public grade school in America teaches critical race theory. Not one. It's a graduate school concept. But how has the uproar over critical race theory affected conversations of race at your school, either as a student, a parent, or a teacher? Reach out to us on Facebook, Instagram, and Twitter at NBC Now Tonight. Leave us a voicemail, 888-575-2NBC, or email nowtonight@nbcnews.com. Up next, we shift from reforming admissions to reforming health care. The same procedure can have very different prices from one hospital to another. We'll get into why that is and what might be done about it. Just ahead. It's bad enough to end up in the hospital. It's worse when the bill almost gives you a heart attack. How do you know if, say, a trip to the emergency room will cost you a reasonable price? It depends on a lot. The Wall Street Journal looked at one example of how prices can vary in Boston. It used new public data to compare 2 hospitals that are a few miles apart. The Journal found a $400 price difference just for the visit itself. That's on top of procedures like imaging scans, which adds the price. What's behind these differences? And how might a better system work? In a moment, you'll meet a doctor with an idea for how to improve things. But let's begin with Melanie Evans. She's one of the Wall Street Journal reporters who worked on this story. Ms. Evans, welcome. Glad to have you with us.
Thanks for having me.
So you were focused on 2 hospitals in Boston. The report includes other hospital systems as well. But the price disparities for ER, the gaps are just kind of all over the place, all over the country. Why does this gap exist? Why is it that if I go to the hospital on 40th Street and the hospital on 50th Street, it can cost so vastly different amounts of money?
Okay, this is the question that everybody's asking. And for the first time this year, we can see very, very clearly how, as you said, all over the map those prices are. And this look at one city let us really unpack it. So we were able to look at price differences between hospitals, and then we were able to look at price differences within a hospital. So the question of what drives those differences can come down to a couple of things. It might be that one hospital has higher underlying costs than another. And it might, because they offer sort of more comprehensive, specialized services, it might be that one hospital has better quality than another. And so they maybe are spending more money to get a better result. And when we talk to healthcare economists, they say, well, yes, across hospitals, that might be part of the reason, but it doesn't explain everything. And within hospitals, that really doesn't explain why the prices are so different.
Yeah, and I also wanted to get deeper into one aspect of the story, which uses a hypothetical patient, but real people are drowning in debt because of these costs. You profiled a woman in October named Barbara Kingsbury, who unfortunately perished from cancer. Now her widow, her husband, is left with a medical bill of $100,000, and that's with insurance. How does this happen? How actually are hospitals getting away with this?
So this is kind of an illustration of the fact that insurance is not a guarantee of a competitive price. And it comes down to this sort of question you started out with. Why are the prices so different? And what we found when we looked at Barbara Kingsbury's bills is that she paid prices that were higher than other people did. And in fact, she paid 2 different prices for the same scan at the same hospital. So it's the same patient, same hospital, same imaging equipment. She got 2 different prices for it. One of them was $8,000, one of them was $2,000. And really what it comes down to is if you strip away reasons like quality or underlying costs, what you're left with is leverage at the bargaining table. So hospitals and insurance companies bargain. And sometimes one has more power than the other.
Yeah, forgive me for interrupting you. I know our time is very, very short.
Yes.
I hate to be overly, trite and concise about this, but before I have to let you go, it sounds like part of what you're saying is that hospitals are doing this because they can, because in a number of ways they just are able to get away with this, and that's sort of the way that it's been. Is that too cynical a way to view it, or is there a little bit of truth to that? Briefly, before we go.
Okay, so yes, hospitals will price what the market can bear, and they can do it at the bargaining table with insurers, and insurers sometimes have the market power to push back, and sometimes they don't.
Melanie Evans of the Wall Street Journal, I appreciate you helping us start this conversation. It is a fascinating report in the Journal. Thank you very, very much. We appreciate it. Now, many of us have stories about hospital bills. Helen from Austin recently ended up in the ER after a car accident. Here is what Helen left in our inbox.
I have a whiplash for a car accident. I went to emergency room in St. David's Hospital. I was there for about 3 hours. They sent me for x-ray to check if my bone is broken on my neck. They charged me $6,000 for x-ray and then being on the ER for 3 hours. They did not do any stitching. They did not take me to the operation room just to check on my bone, my neck. They charged me $6,000.
Wow. Helen, thank you very much for sharing your story with us. Let's continue now with Dr. Mark Harrison. He's the president and CEO of Intermountain Healthcare in Salt Lake City. Dr. Harrison, welcome.
Thank you. It's really nice to be here.
So $6,000 for an X-ray, no stitches, wasn't admitted to the OR, just to scan your neck and say what's going on. This feels like another one of those cases where they charge this because they can. Is there more to it that I'm not seeing?
You know, there might be more to it, but that's an outrageous price. I suspect that this person didn't have insurance and was billed the full rate without any discounts, but this is still not correct. I think one of the big problems we have is, you know, emergency departments are staffed up to take care of real emergency. Big traumas, car accidents, heart attacks, strokes, people with respiratory failure who need to go to the ICU. And they're very expensive places. And when people go to the emergency department with relatively minor problems, the costs can be just absolutely out of control. And so at Intermountain, we do everything we can to take care of people in the least expensive, least restrictive, and high-quality environment possible, try and keep the costs down. And the other piece is, and I think Melanie, who I really respect her, she's a fantastic journalist, she was talking about is the lack of transparency around cost. And the study that she was citing is based on cost transparency rules that fewer than 10% of health systems have been compliant with. And so it's this really opaque system that benefits from putting people in really expensive environments when maybe they don't need it.
I want to ask you more about this article you wrote in the Harvard Business Review about some of the things that you're doing at Intermountain. But before I do, these rules about price transparency. Can you just briefly sum up what those are? That sounds like the kind of thing that I, as a patient, would like to be able to see in those moments where I get to pick where I get my care.
The Trump administration put in place rules that asked us to be transparent about essentially what our charge master was, you know, the menu of charges. By the end of 2020, and less than 10% of systems were fully transparent with those. And at Intermountain, we really believe in this, and we actually didn't know what was going to happen when we became transparent with our prices. And turns out that we were substantially below market in virtually every category, which made us happy. We still have more work to do on price transparency and cost.
Some of the things that you mentioned in your Harvard Business Review article seem pretty simple. They're things that have been happening for a while. One of them is just expanding telehealth and in-home hospital services. I can understand how the pandemic may have made in-home hospital services harder, but telehealth feels like the kind of thing that the pandemic is kind of built for. I know a lot of providers went to telemedicine only. Do you think that the pandemic offers opportunities to move some of these things forward, or is that just another challenge that makes it harder in different ways?
Look, the pandemic's a tragedy. We both know that. Too many people have lost their lives. But we've learned a heck of a lot that is actually very valid going forward. And one of them is we can do great medicine in many cases remotely. And that's less expensive and it's less inconvenient. Allows people to stay at work. It allows people to avoid crowded emergency departments. And it's a lower cost environment. It's really good. The thing that saddens me is many places are actually going back to in-person care as quickly as they can because it's easier for them to make money. So at Intermountain, we're working as hard as we can to maintain appropriate services being delivered at a distance.
One of the things about healthcare, I think, like many things, is that the cost of just providing them on a basic level keeps going up. And there are certain things I see in your article, like adopting value-based care. You know, if the care you're getting isn't actually making you better and reducing your need for health care, then it's not worth paying for. I totally get that. But things cost more, and they will probably cost more 10 years from now than they cost 10 years ago. How much of this can we actually do anything about before we slam up into the reality that stuff just gets more expensive over time no matter what we do?
So look, inflation is going to be super real for the next several years, at least we believe. That said, there's good old Intermountain data which demonstrates that probably a third of healthcare that's being provided doesn't actually need to be provided. Tests that don't need to be ordered are ordered. Imaging studies that don't need to be done are done. Operations that don't need to be done are performed. There is plenty of money in our system if we stop doing things that aren't evidence-based. And there is magic to this idea of being a payer and a provider. We have a not-for-profit insurance company as part of our not-for-profit system. We cover about 1 million people. When we both cover somebody and take care of them, it's to everybody's advantage to do the right amount of care for them and get it right the first time and keep the cost down, which allows us to pass that along in lower premiums and be the low-cost provider and the low-cost insurer. That's the model that we need to go to in the United States.
Dr. Mark Harrison, the president and CEO of Intermountain Healthcare, I appreciate you talking this through with us. Thank you very much.
Thank you, sir.
If you are flying for the holidays, you should stick around for our next story. Incidents like this one, with angry and violent passengers on flights, have crews fed up, and it's easy to see why. Well, now they're asking Congress for help. What this could mean for your next trip when we come back. This holiday travel season is shaping up to be busy despite the pandemic. AAA estimates that 109 million people will travel at least 50 miles. More than 6 million of us plan to fly. AAA also says 30 million more Americans plan to travel this year compared to last year. We might even get back to our pre-pandemic levels. I am looking forward very much to seeing my family and my friends when I fly home. You know who I'm nervous about seeing? The other passengers. You know what I'm talking about. Grown people who seem to have lost all sense of how to handle conflicts. Well, airline crews are sick of it too, and now they say the federal government needs to do something about it. NBC's Zincle Esamwa has the story.
Millions of Americans are expected to travel over the holidays, just as airline workers are calling for the government to act following months of violent outbursts from passengers on planes. I spoke with one flight attendant about what they're calling for and warning you may find some of this video distressing.
I was a flight attendant back on 9/11 when people respected the job that we did. And it's just amazing to me that we've come to this point 20 years later where we have to fear for our own safety.
Tom McDaniel is a flight attendant veteran. Until the pandemic, he never dealt with this.
Sit down now. The second he said something, I pulled it over my nose.
Today, airline workers face angry and sometimes violent passengers. The Federal Aviation Administration reporting 5,664 unruly passenger incidents in 2021, over 4,000 of those being mask-related, triggering an unprecedented number of FAA investigations. With 1 in 5 flight attendants reporting physical incidents the same year, airline workers are speaking out.
How did you feel when these first started happening?
Well, quite frankly, I was horrified. We've had people who have ended up in the hospital. We've had people who have been disabled, who have been out of work for weeks, sometimes months. We've had people who had to deal with a passenger who attacked them, and it took 10 people to subdue that passenger.
Now, calls for federal oversight.
Lately, we have been punching bags. Flight attendants and aviation workers are saying, please make it stop.
Airline worker reps this week appeared before a Senate subcommittee and asked the government for swift action. Advocates in part demanding ban-to-go alcohol and delivery of open container alcohol to gates, a government-centralized banned passenger list, mandatory crew member self-defense training, increased staffing at gates, and more. In a statement, Airlines for America said in part they will continue to, quote, advocate for increased and expedited prosecution for criminal cases of unruly passenger behavior by the Department of Justice. In June, several airline associations sent a letter to Attorney General Merrick Garland requesting more criminal enforcement to deter egregious behavior. The DOJ saying in November, prior to holiday travel, it will in part, quote, do its part to prevent violence, intimidation, threats of violence, and other criminal behavior. For flight attendants like McDaniel, the changes can't come soon enough.
Why do you do this work? What does it mean to you?
It's an amazing career, but it's changed a lot. And it used to be fun, and this is not fun for us. So we want to take the career of a flight attendant back to being what it's supposed to be. Then we also want to make sure that they're going to be protected on the job and that they're going to go home safely.
And Joshua, it's worth noting McDaniel says they don't just want change from the government, but also from airlines. He points out that often disruptive passengers, if they're not arrested, just end up on another flight. And so the hope is for consistent change across the board. Of course, this is even more important now that people are traveling over the holidays.
Thank you, Zincle. That's NBC's Zincle Esamwa reporting. Movies are not just fantasy. They are also part of our history. That is why the Library of Congress is adding 25 films to the National Film Registry. The Librarian of Congress tells us what's being added and why before we go. What do Return of the Jedi, Selena, and A Nightmare on Elm Street all have in common, other than being great movies? Well, actually, this time, that's plenty. And that's why they are among the films that will be archived in the National Film Registry. The Library of Congress has added 25 movies to the registry each year since 1988. Now they're up to more than 800 films. The library selects movies for their cultural, historic, or aesthetic importance to our nation's cinematic history. And this year, it focused on honoring diverse voices. The oldest inductee is from 1902, a short silent film showing a Ringling Brothers circus parade. Look at this. It was selected because of where the parade took place, the kind of place movies rarely showed at the time. A prosperous black community in Indianapolis. Check out this film from 1930. It's called Hellbound Train. Each car of the train, driven by Satan himself, reflects a different sin from the Jazz Age. The movie was made by James and Eloise Gist, amateur black filmmakers who made the movie to support their evangelism. Two documentaries focused on racially motivated violence also made the registry: The Murder of Fred Hampton and Who Killed Vincent Chin. Then there are classic movies with mass appeal, but cult classics get some love too. One other notable addition is Pink Flamingos by director John Waters. This self-described exercise in poor taste was banned in some countries when it came out in 1972. Upon hearing that his movie was going to the Library of Congress, Mr. Waters said, quote, "Pink Flamingos has been shocking people for 40-some years, and now the National Film Registry has finally shocked me," unquote. Joining us now is Dr. Carla Hayden, the Librarian of Congress. Dr. Hayden, welcome.
Thank you. This is an exciting time for us.
It's exciting to see the movies that make the list. I'm always interested in what makes these national registries, and I want to get into some of the themes behind the movies because there are some thematic choices this year as well. But first of all, can you explain a little bit more about the registry, particularly what it means for a film to be in the registry? Does it mean that a physical copy lives at the Library of Congress, or it's digitized, or what does that mean?
Well, the Library of Congress, of course, is the world's largest library, and it has the largest collection of film in the world as well. And it was given a congressional mandate to bring attention to the need for film preservation, just like we preserve documents and manuscripts and all of the other important things, that film as a format is just as important. And so when items are put on the National Registry, that means that not only are they preserved for generations, but we also bring attention to different types of film. And so now we have over 860 films that have been selected to be on the registry, 25 each year.
Some of these movies, first of all, I think are just classics. Films like Whatever Happened to Baby Jane, Pink Flamingos, you know, I mean, the top public request, the public vote was for Star Wars Episode 6, Return of the Jedi. So I just want to be clear off the top, these aren't just like indie art house films, although there's a lot of that here.
No.
There are some real crowd pleasers in here and movies that just had a big impact on the zeitgeist.
And that's the point of it. The National Film Preservation Board is made up of experts, film preservationists, people in the industry. And so it's not just the scholarly types of things or the ones that might get awards, but we've asked the public in the last few years to vote. And people can vote. And this year we had over 6,000 entries. And the two top public votes, Star Wars and Lord of the Rings, were also the ones that the board selected as well, because they have something that really emphasizes that film touches people in different ways. It can entertain, and it can also inform. And so this year we have quite a few films that talk about social issues.
Yeah, there are a number of movies, I'm just looking at the list here next to me, on a lot of different levels that deal with social issues. You have films like Chicana, which is a series of shorts about the Chicano experience, Requiem 29, the murder of Fred Hampton, who was the leader of the Black Panther Party of Illinois before he was killed, even a comedy like Cooley High, a number of these films, the Selena from 1997 about the life of the murdered Tejana pop star, a lot of these films about depicting diversity, but particularly from the filmmaker's own point of view.
Yes, and over time, I mentioned the 800 films, and of course you have Disney films at first, and all of the things, the iconic films, and in the last few years, we wanted to make sure that we widened the aperture and started to include films that people might not be aware of, student films, documentary films, and then lost films, like something, the Ringling Brothers from early silent film, and what's so interesting about it is it captures something that's rarely seen. An African-American community, very prosperous in Indianapolis, and you don't see that often. So it's a mixture of types of films, and then also included animation. Wall-E, that was quite a film and did quite a lot in terms of animation. So we try to cover the spectrum of film history and film possibility.
Do you have a favorite on this list, on this year's list?
Well, I must say Richard Pryor, live concert from 1979. Yes. And here's my battered copy. And I was so pleased because I get to be part of the discussions and to know that something that I really loved and was selected was something that meant a lot to me personally, because that is iconic. So some of these titles, there's something for everyone on this list, and we hope that people will join us next year and nominate.
Yeah, that is one of my, if you haven't seen Richard Pryor live in concert, like, go do it tonight. Don't mess around and wait and think, oh, that'll be on my list later. No, you need to see that right now. Not right now, right now. You need to see that right now. One last thing before I have to let you go, Dr. Hayden. In terms of film preservation, I just want to note that part of the work that you do is the actual physical preservation of film. I think now that everything is becoming digital, we think that material media live forever. But there had been a study that came out some years ago that said that 70% of all silent films are lost forever because there are no prints left that can be preserved. So part of the work, including a number of the pieces on this list, is just to try to capture things that will literally either degrade, possibly explode because there were nitrates in early film stock, but things that are physically not going to survive unless we save them right now.
And another mandate for the Library of Congress is that preservation effort, and we are in partnership with universities and studios, and we have a special campus, the Packard campus, that's just devoted to film and sound recording preservation. And so that's another part of what our effort is that these are treasures that need to be preserved, just like Thomas Jefferson's draft of the Declaration of Independence that we preserve and put in a vault. We are now making sure that these film treasures are preserved as well.
I have to say that as someone who totally geeks out over quite a few of these movies and has gotten the derision of people for, oh, why are you a fan of that? Oh, that's just so childish. That's so silly. It's nice to know that there is a place for preserving these things as an act of Congress to say this isn't just entertainment. This is a reflection back to us of who we are. I'm looking forward to catching up on more of this list, and we appreciate you catching up with us. Dr. Carla Hayden, the Librarian of Congress. Dr. Hayden, thanks very much.
Thank you. Please vote.
Hey, thank you for making time for us. Come on back next week and do bring a friend. Be sure to follow us online for the very latest on upcoming topics and guests. And remember, we want your stories of talking about race on campus or stories of talking about COVID with your kids. We are at NBC Now Tonight on Twitter, Facebook, and Instagram. Leave us a voicemail, 888-575-2NBC. That's 888-575-2622. Or you can email us nowtonight@nbcnews.com. And with that, your weekend may begin. But until we meet again, I'm Joshua Johnson. Have a wonderful weekend, and we'll see you Monday. Good night.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.